Hello everyone, my name is Janelle, and today I'm going to be doing a presentation on the Swan neck presternal peritoneal dialysis catheter. So the learning objectives for this presentation, we are going to review the presternal peritoneal dialysis catheter, analyze the reasons why it is the best all-around choice for PD. By the end of this presentation, the learner should be able to list advantages and disadvantages of the presternal PD catheter, describe pre and post-op care of the catheter and exit site, and discuss the patient's perspective on the presternal catheter. So this is a picture of what the presternal catheter looks, the internal and external components. You can see blown up on the side, there is the titanium connector. There's an internal portion and an external portion that is connected with a titanium connector on the inside of the patient. So the presternal catheter is made of a silicone rubber, and it's has a titanium connector on the inside like we saw in the picture to connect the internal and external tubing. Advantages of the presternal catheter are it has several possible exit points, which helps to improve body image. It has a firm anchor, which decreases trauma at the exit site and aids in healing. It has a decreased likelihood of catheter tip migration, which will decrease leaks at the exit site. These last two combined will create an associated lower risk of exit site infection and peritonitis. And then the final advantage is that it can be used in patients across a wide BMI scope. So patients with normal BMI or patients with a very high BMI can use this catheter. Disadvantages, it has a slower installation of the dialysate fluid because of the longer tube. There is a risk of the tubes disjoining internally, but that's rare. There's a more complex installation compared with a single shorter PD catheter. Like we saw in the picture, there are two incisions that have to be made as opposed to just one with a shorter catheter. So pre-insertion prep. First of all, we're going to educate the patient. We're going to let him or her know all of the different types of catheters available, the advantages of this and disadvantages of them all, and then have them give informed consent. Discuss with the patient on the preferred exit site. Some patients may want it high on the chest, and some patients may want it low on the abdomen. We also want to assess for hernias and repair before the procedure because peritoneal dialysis will put extra intra-abdominal pressure on the patient. We want to make sure that there isn't any weak points in the abdomen. So any hernias need to be repaired before the procedure. Pre-op care, most hospitals would say that the patient needs to be NPO at least 6 hours before the procedure with bowel prep. And you just follow hospital policy for that. We want to draw some lab, CBC, CMP, coagulation studies before procedure, and some hospitals require a COVID test before any operations, so we'll just follow hospital policy on that. Then you're going to hold blood thinners before the procedure to avoid any kind of intra OR or post-op bleeding. Post-op care, we're going to have the dressing on the exit site should remain undisturbed for 7 to 10 days to allow the exit site to heal and to create that firm anchor and tight seal. We're going to flush the catheter with up to 1,500 mils of dialysate to prevent clogging and to clear any clots in the tube. And we're also going to anchor the exterior portion of the catheter to prevent trauma to the exit site. Long-term care of this catheter, we're going to use topical antibiotics or CHG discs at the exit site to prevent bacterial contamination, to decrease the risk of infection. We are going to do dressing changes weekly and PRN. If there's any redness drainage, the dressings will be done more frequently. Avoiding submersion of the catheter. Again, just helps prevent the site from becoming contaminated. And then proper hand hygiene before handling. Then if there's any redness, swelling, or purulent drainage, that needs to be immediately reported to the healthcare provider so that we can start antibiotics. Patient perspective on this, the catheter site can be high or low on the torso, which allows the patient to maintain his or her preferred lifestyle. Some patients may want to be able to take tub baths, so they can have their exit site high on the chest. Other patients may just want it to be hidden, which they may want it low on the abdomen to facilitate that, which leads us into the next point. The exit site can remain hidden, which helps to improve body image. The patient is more likely to be on board with their catheter being in place if they can have it hidden. And that takes me to the end of this video. Thank you for watching.